In previous years, our group has traveled abroad and worked to empower different communities across Latin America by creating sustainable change as part of a Global Brigades holistic model. In 2019, our group went to Panama and spent 3 days working alongside community health workers and doctors to provide a free health clinic for underserved communities. Additionally, we spent 2 days hosting a wellness clinic where we discussed important aspects of personal health and held fun and educational activities for the kids. With the COVID-19 pandemic, the health disparities we see across the world are only magnified, and Global Brigades' mission to create sustainable change remains as important as ever.
Global Brigades has adapted their strategy for empowering communities abroad by creating new virtual initiatives for volunteers. These programs allow brigades like ours to work remotely with communities, allowing us to maintain the mission of sustainable change, while ensuring both the safety of our patients and group members. This pandemic has empowered us with the ability to change and adapt. Global Brigades and Carnegie Mellon's Global Medical Brigades have adapted our approach so that we can continue to address both health and economic disparities across the world. To empower our underserved communities, we must continue to create sustainable solutions using a holistic approach.
In that spirit, last year, we had 23 brigade members participate in our first Virtual TeleBrigade. We made use of a virtual platform to support 2 medical clinics so that underserved communities continue to have access to free medical care. During last year's TeleBrigade, we met with local healthcare workers and learned about the healthcare system in Honduras. We also learned about common remedies and medical issues in the country. We then met with community health workers in a rural village to learn about their work. We also had basic medical Spanish lessons taught by Global Brigade staff.
Once we were armed with the knowledge that we needed, we had virtual shadowing stations where we got to practice our Spanish and watch physicians in Tegucigalpa, the capital of Honduras, treat patients. We were also able to have a virtual charla where we focused on mental health during the pandemic and preventing the spread of COVID-19. These were topics that we felt were important to the pandemic, and we created fun and educational videos as a brigade to help better educate the community members in rural Honduras.
Although we will not be able to physically work alongside doctors and community health workers, we are excited to still be able to do our part to increase access to healthcare around the world. Regardless of whether we are in person or remote, we look forward to another year of working with Global Brigades and promoting our mission of equity in healthcare together.